Approximately 600 employees at the U.S. Centers for Disease Control and Prevention, CDC, have been terminated as a part of the most sweeping restructuring in the agency's history. The Department of Health and Human Services had announced in March of 2025 that the agency would cut around 2,400 jobs. Health Secretary Robert F. Kennedy Jr., leading the restructuring under President Trump's Make America Healthy Again initiative, says the cuts are about realigning the CDC with its core mission.
When my team and I took the helm at HHS, we set out with clear goals. First, we aimed to make America healthy again with a special focus on the chronic disease epidemic. Second, we committed to delivering more efficient, responsive, and effective service to over 100 million Americans who rely on Medicare, Medicaid, and other programs. Third, we focus on achieving these goals while cutting costs for taxpayers. We intend to do more, a lot more, with less. The United States remains the sickest developed nation in the world, and we spend $4.5 trillion annually on healthcare, 2 to 3 times more per capita than comparable nations. Clearly, something is structurally and systemically wrong with this system. At the CDC, we will return to core missions, tracking disease, investigating outbreaks, and sustaining public health infrastructure while cutting waste.
The layoffs hit across the board, including the Division of Violence Prevention, financial offices, IT, equal employment units, and more. A spokesperson for the Federal Workers Union said the terminations are widespread, and many highly recognized experts are now gone. A federal judge in Rhode Island issued a partial ruling last week, protecting staff in programs like smoking prevention, reproductive health, workplace safety, and birth defects. But other divisions weren't spared. Projects to fight rape, child abuse, and teen dating violence were among those slashed. These cuts come less than 2 weeks after a gunman opened fire on the CDC campus, killing a police officer. Officials say the restructuring was already underway, but the timing has raised new concerns. Meanwhile, Secretary Kennedy has been pushing major policy changes at the CDC. In May, the agency removed COVID-19 vaccines for healthy children and healthy pregnant women from its recommended immunization schedule. Then in June, Kennedy fired all 17 members of the CDC's Independent Vaccine Advisory Council, replacing them with new picks he says will restore public trust in vaccines. The restructuring is far from over. Kennedy insists the CDC will now be more efficient, less bureaucratic, and more focused on protecting public health.
In your opening statement, Mr. Secretary, you said that you're committed to reducing bureaucracy. But as reported in the Washington Post on April 17, 2025, HHS imposed a new layer of bureaucratic review by which every disbursement has to go through political appointments at HHS. Hospitals, universities, and community health organizations have told me and the other members lately that funds are stuck at HHS due to this so-called Defend the Spend initiative. I asked you about this in the April 23rd letter over 2 months ago, to which you have not responded, and I'd like some answers. Yes or no? Did HHS conduct a cost-benefit analysis on the Defend the Spend procedures?
I don't know anything
You
about
don't
that
know,
Washington
okay.
Post article.
In letters, you don't know whether you did a cost-benefit analysis, right?
I don't know. I know that. I don't
Okay.
know anything about that Washington Post article. I
No,
don't
do you
believe
know
it's
anything about the Defend the Spend initiative?
About what?
The Defend the Spend initiative that your agency has? You don't know about it. Mr. Chairman, I have an article here dated April 17, 2025 about the Defend the Spend initiative. I'd like unanimous consent to enter it into the
Without objection.
Now, in Mr. Secretary, on June 9th, hundreds of NIH scientists sounded the alarm on how this administration has wasted millions of research dollars, injected politics into science, and damaged the public trust. 68 Nobel laureates signed this letter. On June 10th, We sent you a letter. Of course, we haven't gotten a response with our concerns that you or your staff might retaliate against them for telling the truth. So here's my question. Will you commit today that neither you or anyone else at HHS will take any retaliatory action against the brave scientists that work at NIH? This should be an easy answer because it's illegal.
I can commit that we are absolutely depoliticizing science at
Will
NIH
you
for the
commit
first
that
time.
you will not take any
Biden
retaliation?
administration,
Excuse me.
Ms. Chairwoman, the Biden administration politicizes science, and I just
Okay,
gave
excuse
you,
me,
I just
sir.
gave you 3 of thousands
Excuse me,
of
sir.
examples of
Excuse
how
me,
they
sir.
did that.
Excuse me, sir. I asked you a simple question. Will you commit to not taking retaliatory action against the NIH scientists that signed the letter about the research dollars? Yes
I don't
or
know
no?
anything about that letter.
You don't know about the letter?
No, I
okay.
don't know anything about that letter. This is the
Okay, well,
first
we'll
I've
put
heard
that,
of it.
we already put that, our question in the record. I'd like a response. Now, in my last few minutes, in our letters dated February 28th, April 1st, and May 28th, to which you did not respond, we have some questions about reductions in force. How many HHS employees received RIF notices since you were sworn in?
I think around 10,000.
10,000. Did you personally approve those layoff decisions?
Of each one, I approved of the policy.
Thank you. You approved the policy. Your NIH director, Jay Bhattacharya, told employees, quote, "I actually don't have any transparency into how those decisions were made, and I was quite upset about that. It would have been nice to have some say."
You have made a number of major decisions about vaccines, and again, there's been no public comment process or public accountability on that either. What are you afraid of? I mean, with regard to vaccines, are you just afraid of receiving public comments on proposals, or you just think these are fringe views that are contrary to the views of most scientists, and that the public comments will reflect this? You say you want transparency, but there's been no public process for any of this.
We have a public process for regulating vaccines. It's called the ACIP committee, and it's a public meeting. There will
You
be public
fired the
comment at that
committee.
meeting.
You fired the
I
AS.
fired people who had conflicts with the pharmaceutical industry.
Oh, I mean, that's...
That industry, that committee has
there's
been a
been no-
template for medical malpractice
All right, look,
for 30 years.
I can't. The bottom line is here: we have no transparency. We have no response. You feel no responsibility to Congress whatsoever, and you just continue this ideology that's anti-science, anti-vaccine. That's all I see. I see nothing else, and I don't think I'm ever going to get a response. And so I'm going to have
Will
to
the
ask.
gentleman yield?
If I can take a minute just to respond to something that Congressman Pallone said, and I'll address you, Congressman Pallone. 15 years ago, you and I met. You were at that time a champion for people who had suffered injuries from vaccines. You were very adamant about it. You were the leading member of Congress on that issue. Since then, you've accepted $2 million from pharmaceutical companies in contribution, more than any other member of this committee. And your enthusiasm for supporting the old ACIP committee, which was completely rife and pervasive with pharmaceutical conflicts, seems to be an outcome of those contributions.